I vote to approve.
Dax.
I can second it.
All right, so I have Dax with a motion. And Matt, a second. All in favor?
All right.
Aye.
Aye. Are there any opposed? None opposed. Next item, approval of the May 6th, 2024 meeting minutes. May I have a motion to approve the May 6th, 2024 meeting minutes?
I so move. Marcia.
I'll
Thank you,
second
Marcia.
Patrick. Paula.
Paula, thank you. All in favor?
Aye.
Aye.
All right.
Any opposed? Okay. So next item on the agenda is public input. So on our public input today, we have some members joining us from the Northern Valley Catholic Social Services. So between this meeting and more than likely the next meeting, you're going to hear some information and updates from both Northern Valley Catholic Social Services and Plumas Rural Services around their respective disaster case management programs, and really the entirety of the disaster case management program. So we do have that later, a piece from PRS on the agenda later on, but for right now, I'm going to turn things over to Cindy Barrett from Northern Valley Catholic Social Services to just talk to the team with some of her team members about what it is that they do and how they work. Thank you, Cindy.
Yeah, thank you, Patrick. So hi, it's so lovely to actually meet some of you guys. So I'm Cindy Barrett. I'm the program manager of disaster case management with Northern Valley Catholic Social Service. As you know, the most of you guys know, we have been federally funded along with Plumas Rural Services, Paula and her team, to manage the Dixie Fire. And unfortunately, that contract with FEMA is set to sunset here in August of 24th of 2024. So a little bit less than 3 months now. And there's still some work, of course, that we would love to be able to continue doing there in the community, specifically revolving around the rebuilds. So we're just hoping to bring to the committee, along with North Valley Community Foundation as well, a proposal to hopefully extend our program again to continue doing this amazing work. So here on this call, I'd like to also introduce, I have Carla Soto, who is currently our intake and referral specialist, and Mr. Ryan Crow, who is the Assistant Director of Disaster Management Services within our agency as well. See, I'm nodding. So I know Carla's going to go ahead and share this screen, and we have just, again, a quick presentation for you guys. So please feel free to interrupt us, ask any questions along the way as well. And I'll go ahead and get us started. If you want to go ahead and start, Carla.
Carla, I just changed the permission, so you should be good to share. There you go.
Are you able to see that full screen?
No.
Says
No,
presenter window.
There you go.
You see it full screen?
No.
Okay, yeah, let's try this way.
There you go.
Awesome. Thank you. Technology, right? We're into how many years of Zoom? This is why I love in person. So again, as I kind of mentioned, we have a proposal, funding proposal for August 2024 through August 2025. Want to go to the next slide, Carla? So just a little bit about our agency. We have been established since 1986, and our focus is very much a wraparound service from children through families and any, again, in between. Our agency is very keen in inspiring hope and transforming lives, and we have very strict, phenomenal guiding principles that truly we adhere to on a daily basis, and especially with all the programs that we do. So again, our major focus is, that human dignity in life, and we want to make sure that we're calling for participation within the, our families and all of the community to really provide, again, that wraparound service. And more specifically, we really truly like to advocate for the most vulnerable of population, especially as we've hit so many various disasters in the last, I want to say honestly, since the dam kind of happened down here in Butte County. It's really put a lot of the communities in a very vulnerable state. So we truly want to advocate for those family most in need. And then we really truly want to empower those folks. So again, one of the major goals of disaster case management that really is wrapped around the concept of contributing to the independence of our survivors as well. We want to be able to walk alongside them, but more than anything, we want to be able to recover through their path with them up until the point where we are able to take a step back. And we do that each and every site visit and each and every appointment that we have with survivors to truly allow them to take over their recovery journey and for us to kind of step back as well. And again, kind of our last guiding principle in there, serving one universal family. We, again, truly provide that wraparound service, and we want to just make sure that we're helping as many community members as possible. Can you do next slide? So within our current request right now, the disaster case management kind of principle in here is guiding survivors to their recovery by nurturing resilience. We truly, again, want to be able to walk alongside them and be their advocates and teach them, on building that resiliency and that mitigation. So again, that request is for a 1-year extension. It is minimizing our program to 3 full-time employees. We currently have a staff of 10. So it is extremely reducing that program, which again, really understanding what the community needs are. And this was the best that we were able to really fit within the 3 FTE. So we would be reducing the staff by 7 as of August 25th, if we're able to continue this program. You guys will be receiving, we have submitted a full application, which includes more details of the budget as well in there. If Patrick hasn't had a chance to send that out to you guys, but you will be able to fully review that Excel budget as well. And foremost, what is disaster case management within our agency? So we've truly been embedded within the disaster case emergency management, I should say, realm since 2014. A lot of our programs at Guild are really built around that resiliency piece and emergency management, which also includes some coaching, some counseling sessions. So again, it's a very broad experience our agency has been able to provide. We have managed 9 federally declared disasters and 3 federally declared. So still, even though FEMA has not provided that disaster case management program, we have still been able to seek out the communities in need in the 8 surrounding counties. So we officially provide support to 8 counties. But realistically, we kind of go beyond the county barriers if there are any support in need within our agency as well. We currently have, again, quite a bit of partnerships because we have been able to break down a lot of those barriers, especially when it comes to emergency management and the services needed. So we have those partnerships with the Sacramento Diocese, Catholic Charities USA, Catholic Charities in every single state as well, which multiple areas have a Catholic Charities. So I think California alone has 6, so we definitely have that support within those entities as well. Global Giving is Center for Disaster Philanthropy, American Red Cross, United Way, NVCF, Cal, yes, local volunteer organizations during disaster, and then again in that long-term disaster recovery process as well. So with this, again, we've been able to establish those partnerships in relation to additional support that would be going back 100% to survivor needs. So for example, one of the major projects that we were able to launch this year was Global Giving. And it's a fantastic contribution where it's reaching nationally. I mean, we're receiving donations for all of our disaster projects, which we do have a Dixie Fire page on there. And we've been receiving donations that are coming, again, 100% directly into survivors' hands. And we're able to really identify what those projects are. So for example, if we identify that we need 15 survivors that need specific funding for the permitting fees. So we're able to really tailor that in the Global Giving to specifically address those needs and really heighten that awareness in a global, again, nationally recognizable rather than just local entities as well, or even statewide, which is fantastic. Do you mind going to the next page, Carla? Thank you. So again, one of the questions, what does disaster case management do? So disaster case manager helps a disaster survivor develop a realistic recovery plan and work with other agencies to meet those needs. The key word on here is realistic. Again, when we're talking about wanting to build a recovery plan, we want to be able to, we focus on safe and sustainable housing is a major thing. And then in addition to build a recovery plan that is unique to every single survivor themselves. And again, that word realistic, we always want to ensure that it's the need versus the want conversation. So especially when we're receiving donated funds, we want to ensure that we're being good stewards of those funds and ensuring that it's going to what their donation purpose is for. So again, we focus each disaster recovery plan could be a short and or a long-term that is identified between a tier level system. So as soon as a survivor is enrolled into our program, of course, the most vulnerable of extreme cases and rebuilds are going to be more of that long-term recovery, just because we understand the length of the process and every single phase that needs to be met within that recovery process. So coordination into services, again, is that partnership that we have been able to establish on a statewide and even national level to receive support within our organization, individualized support, advocacy and empowerment. That's kind of what I was mentioning earlier, that we do a lot of preparedness as well, where we are able to coach our survivors so they can be able to take on their recovery plan once we're able to phase out in that disaster recovery plan. Rebuilding advocacy. The major piece within the rebuild advocacy is we want to make sure we're avoiding construction or contractor fraud. Unfortunately, that has been something that has been seen. So we just want to make sure that, again, it kind of comes with that individualized training plan as well to ensure that a survivor is receiving that oversight, which we do have two actually fantastic construction cost analysts within our agency that have more than 25 years of experience in construction cost analysts, in addition to our housing program that we also have internally that is able to also provide that support. Funding resource kind of covered a lot of that, again, within our partnerships that we receive. And in addition to, we have that post-disaster mitigation and preparedness as well. Again, we really want to be able to educate the community, because if a disaster happened in a specific area, the likelihood of occurring again, unfortunately, does increase. So we just want to make sure that folks are able to be prepared in the case of an additional disaster, to include children again. So we really want to focus on the whole aspect of family as well in that preparedness plan. This is our current information that we have. So survivors that we have served to date. So that's from the very beginning of our program, again, federally funded up until today. So we have served 446 cases, successfully closed 430. So again, that could be anywhere from resource and referral to providing actual monetary assistance. We currently have 36 cases open. And as I mentioned, that tier level system of knowing how long a case is going to be open, we were able to identify that currently right now with the cases that we have, 1 month to 3 months, we'll be able to close out 5 of those cases, 9 between 3 to 6, 10 between 6 to 9 months, and then 12. So anything that's a year or longer, again, that's usually those rebuild projects that we have identified 12. Currently, right now, the number of in progress and or applying for the Recover California within our current caseload, we have 10, and current 3 have actually successfully submitted that full application process. There are 50 potential survivors that have let us know that they will potentially need additional support. This is based on phone calls that we have done since the very beginning and or site visits from either FEMA data that was provided or any community outreach data that we were able to gather. And these folks let us know, yes, we are potentially interested in disaster case management. However, I'm just not ready yet for various reasons. It could be, a lot of them were in that PG&E phase with, the litigation versus the entire lawsuit process. Some of them are still trying to identify whether Recover California is going to be a good program versus if they want to utilize some other means of volunteer rebuild. So that's where we want to be able to continue working with these folks and hopefully transition them into applying for, again, that Recover California, as we know there's some open positions. Currently funded in the simple unmet needs roundtables. So we meet usually on a weekly or bi-weekly basis. And that's any request under $10,000, $74,041.04. Total funding through the SHOP program, which is through United Way, $28,524.94. And then total funding to date is at $2.3 million on there. And these are funding resources that have been from various donated options and or referrals that we have done within our agency as well. I'm going to go ahead and pass it on to Miss Carla.
Yeah, hi. So I'm just gonna bring and share one of our success stories through one of our DCMs working closely with the client. She was able to advocate for them and fill in an application through the Stable Housing Opportunities Program of United Way and get about $4,447 for furniture. They lost everything in the fire, their home, all of their belongings, and they had to relocate to find permanent housing again, and they landed in Chico. And our DCM was still able to advocate for them through various avenues of funding and get them an additional $1,000 of unmet needs funds to replace some household goods. And the client let us know that initially they were skeptical whether they were able to receive any assistance since they would no longer be still in the Plumas County area. And they were really thankful that we were still able to partner with them and provide them with additional resources or referrals, phone numbers of people to get connected to within their new community, because we know that often relocating to a new place is very stressful, very hard with children as well, and they needed that extra support in this new community they were going to start to call home. So the next I'll be covering our program objectives with this new request. We are wanting to provide tailored case management for rebuilding efforts, make sure folks who are wanting to pursue that rebuilding receive all the support and guidance as they can. So support rebuilding homes. We have assisted 3 survivors with enrolling with the CDBG-DR grants and are hoping to still provide additional support after they go through with that process. They will get their case manager through them if they are going to continue, but we still provide any additional help that they may need through the process. They're not dropped from our program. We're as involved as they want us to be. And we're looking to assist the rest of the clients who are in that kind of whether not knowing if they're going to continue and apply or what they want to continue doing going forward. We will continue to enhance coordination and resource access. So coordinate with local agencies and nonprofits, organizing meetings with the community members, seeing how we're able to provide for whatever needs are in the community and how we could possibly step in and support. We also help facilitate events to draw people from the community together. We have been very supportive of the AU House gatherings each month and also hosted and participated in the community picnics. The picture on the left is from when we did a short program of providing shoes for children in the elementary and I believe high school students as well. For those who needed that extra support, we were able to find donations and another funder who provided us with brand new shoes for those who needed it. So again, our community engagement is really important to us. We know that we are not locally based in Plumas County, but we are actively up there a few times a week. We are actively participating in multiple events throughout the community, in public meetings as well. We want to make sure that our presence is known. So we're active with the high school, picnics, fellowship. We were active in supporting the thrift store opening, the tool shed project, and that's again whether we can gather donations and be some sort of financial assistance or just physically being a presence up there, connecting with folks, letting them know that we are still available for our services and to help them with whatever questions they may have and enrolling them into our program. And throughout this, we will keep very good data of what we are up to and what we are doing and reporting that back. So setting up evaluation systems, knowing how many folks are in the rebuilding process, what milestones they have achieved, what barriers they might have, or where they're at, and how maybe we can pull from different organizations to support them through the process, how many applications we've processed, and also our client satisfaction. So providing that information back to folks and performing the quarterly reviews to assess the progress and any strategies that are needed, anywhere we need to adapt to what's currently occurring. I know we've passed, the winter storms, but that was a big thing that impacted a lot of the survivors and added to that recovering from fire and then the winter storms coming in. So we had to adapt to what their new needs were becoming. They had their fire needs and now they had their winter storm needs because maybe their housing was being compromised for those folks that, for example, were in trailers. So we had to adapt with that, change our strategies on how to support them, how to access some more funding possibly to help them make those repairs to their homes that they had. So we would be reporting all that information back to you all. And lastly, why do Dixie survivors need DCM services? So the Dixie Fire burn scar area is the geographical location of it. It is hard to connect with outside resources. Local resources are heavily impacted with people, contractors having wait times to get out to properties, to assess things, to give estimates. And I will give the example, we had a DCM assisting a client who needed a roof repair and he needed a couple estimates. This DCM, she's been a DCM for 5 years now, working across multiple fires, and she was able to go through the listings of everyone within the local Plumas County area to get someone out there and assist and help this client. And she got some no answers and got some, hey, I can help you out in 2 months, 3 months, that sort of thing, which it's going to happen and it's normal. These folks have a long wait list. But she was able to network and access some resources from her previous just knowledge and branching out and networking, and she was able to bring someone else in to make the drive, come up there, give them the estimate for everything, and it really showed this specific survivor that we are willing to continue to work. You know, we hit those barriers, but that doesn't mean we give up. And we will use any of our networking that we have in the past, collaborate with our other disasters within our agency as well, to see how we can still continue to support. But most importantly, the DCMs provide that support. We are as involved as our survivors want us to be, and we provide, like again Cindy said, that realistic recovery plan of how we can get these folks back on their feet, stable, safe housing for their families, and kind of get them back together again as much as we can, you know. And I believe we are at the end, so thank you all so much for your time.
Yeah, thank you, Carla. Thank you from the NVCSS team. And again, for the steering committee, NVCSS will be on the next meeting's agenda. So if there's additional questions that you have, can elaborate more fully. I'll get the copy of this brief and send it out to y'all with their funding request. The funding request came in on Friday afternoon, Friday evening timeframe. So I'll have that printed off or PDF'd over to y'all at the next meeting. At our next regularly scheduled steering committee meeting. In the interest of time, I do want to move on to our agenda, unless there are any reservations on that. Yes, Trina, go ahead.
I do just have one simple, well, to me, it's simple question. It was a really great presentation, and it's giving us a lot to think and consider over the next week. But I also, in my mind, am prioritizing the conceptual master plan that was presented at the April meeting as kind of something that we really want to fund and support. And so it would be interesting to me. I think part of what you presented today, it sounded like there might be some support that North Valley Community Social Services has brought other funding into the process to help support some of that need. But I'd really love to hear more about how there might be a tie-in for that support with the work that you guys are doing. So if that makes any sense. And if that's just out of your scope, that's fine too. I just am curious about that. Thank you.
Sure, I can handle this one. Cindy? Yeah, so we internally have a grants committee. So anytime that there's a community need, the only thing that we have to do is look at different funding that's available, either that's federally or the state of California or locally, and then continue to write grants. Another option that we have, since we are a Catholic Charities USA partner, we can always write a short-term recovery grant, which is up to $25,000, or a long-term recovery grant, which can be $100,000 plus, that we can write off and then if it gets approved, we can just bring it back in and to support the community's needs as well as the program. Cindy did briefly talk about global giving, so that's an option. And then I'm sure at some point you guys will all see it. That's a live website. If there's things that we can always change to fulfill your guys' needs. We also are pretty close with the Center for Disaster Philanthropy, and they have a couple funds supporting disaster case management, and we have also quite a bit of funding that's currently under review, and if we get them, that would also directly support this program as well.
All right, thank you. I think that's really helpful as our funding kind of is getting spent down and looking at how we can meet more of the greater needs. Thank you.
Mm-hmm. Yeah. Matt Fogarty.
What's the difference between the DCM work, your DCM work, and the PRS DCM?
There's absolutely no difference. We're both been federally funded. We've both been through the same training process. We're just two different entities that have, again, various strengths in the disaster case management realm, but essentially we provide the same level of service. However,
I feel like we have been working within emergency management since 2014, and NVCSS has, in a lot of ways, been the pioneer in disaster case management. for the two largest at the time incidents, which was the car fire and the campfire. And then we were the lead entity for disaster case management, as well as we have people internally that are so well versed and so well trained in disaster case management, have been requested personally from Catholic Charities USA to teach on the national level in regards to training other entities within the Catholic Charities Network and the diocese of how to properly conduct disaster case management.
Okay, a different question. What's the connection between your organization and the Catholic Church?
Yeah, so we are kind of governed by the Diocese of Sacramento, and we're also connected to Catholic Charities California as well as Catholic Charities USA. So a lot of the Catholic Charities USA gets funding from multiple dioceses, also something called a wildfire collection that's collected through local dioceses all across the nation. And then as disasters happen, they can receive donations either through collection and disperse them out to areas that are needing assistance, such as the Dixie Fire area.
Thanks.
Okay, yeah, good questions and definitely some additional follow-up. Again, this team will be here on I think our next meeting, if I remember correctly, is going to be on June 3rd, as the first Monday of June. And then we'll have a little bit more of an understanding of what their specific budgetary request is and what they are looking for. So the brief that was just shared, I'll get a copy of that to include in the next steering committee board packet. So again, thank you to the NVCSS team for sharing the information that you have thus far. Okay, moving on to our next item. Was just additional follow-up documents, spreadsheet, and some relevant information provided by Michaela Trammell of the Dixie Fire Canopy Project. And then I sent out another a presentation that Michaela put together for that also kind of encapsulated some of the questions. And I will turn it over to Michaela if there's any additional refinements you want to add, Michaela.
Sorry about that. I just want to thank you guys for giving us the opportunity to present to you and the consideration. We've done a lot of quite a few properties so far, and we're out here doing some more. And so we just want to say thank you. And we've got, I've got some of my crew here who's here for the decision today. We've got one of our first funders, the Rotaries, doing their community supper. Make sure you guys come on out today and enjoy that. So everybody's we're just waiting to hear what you guys are going to say.
And Michaela, was there anything on your slideshow? I can go ahead and present that now. Was there anything that you wanted to specifically talk to with that presentation?
Yeah, so we've got some of what we've done. This is our targets. If you go to that one, we've got 93 properties signed up. As of now, at 100 properties, we would have to probably close it for the year because, funding is limited as well as our capacity to plant. That would be 100 residential properties. That would be 400 trees. Commercial properties averaged at about 6 trees per property. That, is a pretty significant amount there. So that would be another 180 trees. So if you keep going, that would be the totals you've got down there of the amount of trees we would plant. Then you've got our achievements to date on the next slide there. You've got all of where we've received our funding or committed funding. We have yet to receive the Pacific Gas and Electric funding just yet, but that's coming. And then you've got total purchased plants, signed up properties, and properties served so far. Then you go to the next one. I think you're going to have a little bit about what we've been doing lately. Maybe some pictures. I don't know if I can Yep, there you go. We've got some of that peach tree right there is one of the very first ones that we planted on the properties, and you've got another dogwood. You got one of our crew members at work there. So you can see those. There we go. And then assets to date, that's what we have remaining in cash and retained funds, as well as equipment that we use. The trailer is a 2024 trailer we purchased locally from a local family out around the valley. So, we've got that. That's really helping get a lot more trees going, delivered to properties such as Indian Falls, things like that. And then here's what our projected outcomes looks like of what we need to complete projects sufficiently with the commercial properties and residential properties. You've got the costs per trees, you've got the cost per shrubs, and then you've got the breakdown of what else it costs to plant each one of those properties. The total comes out up to approximately about $2,500 per property with labor and materials included. It's just under that at about $2,436 is what we ended up budgeting with Clint Cobley. So you've got kind of what we're looking at there for our numbers. And yeah, thank you guys for I think the next one, I think that might be it. Oh, there it is. Yeah. So there's our totals. And we just kind of appreciate the opportunity to speak with you guys today.
Okay. For the steering committee, are there any other additional questions for Michaela?
Yeah, Michaela. The last slide you put up. So you said, and you were like, it has the could you put that last slide back up, Michaela, so I could just see her? I didn't. So has the Chamber of Commerce committed to $50,000?
No, they have not. That's a request that I'm hoping to present to them. However, if they are unable to complete that, I will keep looking for other prospects. I've got plenty in mind that I've been trying to.
You haven't even requested that yet. You haven't even requested that yet?
I have been speaking to the Chamber of Commerce about some local business funding. However, this is for the entire year. So we're still, we're going through the prospects that we've already spoken with and things like that, as well as this is for the entire year as a whole. So I have I've got a meeting tomorrow with the Keep America Beautiful and Retreat and California Urban Forestry regarding potentially partnering up with them, as well as funding opportunities. I don't know what that amount would look like as of yet, but that's 3 different entities wrapped into one presentation tomorrow. So I can have some better numbers.
You don't have anything written up. There's no, that ask hasn't been formally submitted or anything like that. What about North Valley? Is that just what you're thinking about asking them, what you've actually asked them? Because they were just here asking us for money, so.
So it's one of those things where I have to continue to do and work on my budgets and everything like that before formally presenting. That's an ongoing thing.
Can I just clarify that Greg, the people who
and Greg, just to clarify, Northern Valley Catholic or Community Foundation, that is again our fiscal sponsor, not Northern Valley Catholic Social Services. So,
okay. I'm sorry.
Alphabet soup,
I'm just trying to figure out, looking at the numbers here.
Organizations.
Pardon me?
Yeah, 2 different organizations entirely. Just wanted to clarify.
Sorry, thank you. I'm just looking at the funding requests, and it sounds like none of these have actually been requested yet, other than us. Is that correct, Michaela?
No, I've spoken to Keep America Beautiful, the Arbor Day Foundation's an ongoing support. They've already confirmed that there'll be an ongoing support for the next 3 to 5 years. Retreat and California Urban Forestry, I've spoken to all of them. I have submitted a request for funding for the Chamber of Commerce, not in the amount of $50,000, but there has been conversations with each one of these different foundations. I've spoken to many different people. There's things that are not listed in here, such as a T-Mobile Hometown Grant, Wells Fargo grant. So, I'm actively always looking for prospects for funding.
I believe that.
And Greg, so North Valley Community Foundation also in a previous meeting, they indicated that if DCF does the due diligence, then they would likely follow on with a similar amount. So if we did agree to fund 100K, I mean, this was, I don't know how reliable that is, but that's what they indicated. Maybe Patrick can talk to that.
Yeah, and I would say, and I don't want to speak for North Valley Community Foundation. However, that given that with the Northern NVCF, they have roughly $900,000 that's left uncommitted. However, 600,000 of that it has become committed in terms of a loan to the Greenville Rancheria based off of the previous voting of the steering committee last October. So that means that they have roughly $300,000 left to commit towards things. And I don't know that they are in a position to be able to commit an additional $100,000 at this time. Again, not speaking for them, but I'm just, it's an important data point to keep in mind with regard to the funds available.
Is it fairly solid that they would do a matching grant? Like if we gave $50,000, would they match 50?
I don't want to speak for them. I would say that it's, and based off of that, I would say that it's not fairly solid. I think we would definitely have to have that conversation with NVCF.
All right.
Trina Cunningham, you have your hand up.
Yeah. So at the last meeting, I had said that I thought that there might be other funders interested or available. I thought this is a very highly fundable project, and I did reach out to Audubon, and they are very interested. And so I do have a meeting to sell it to them tomorrow.
Oh, thank you.
And yeah, so it's Michaela, I'm very supportive and I love your project. I just know that the Dixie Fire Collaborative has a finite amount of money. And we're spending it down pretty quickly as well, or have the potential to. And I really would like to see that leverage towards the infrastructure master plan as much as possible. I think this project is fantastic, and I will dedicate myself to doing some of the fundraising to meet that. And with that said, I'm still confused with your budget. It's like to me, I'm not seeing like this is our target amount. This is what we have dedicated or fundraised towards. It feels like it's, and I understand that it's like a moving target, like you're just trying to get as much as you can as fast as you can to get the planting done this spring, or as soon as possible to get trees in the ground. And so that does stress me a little bit, just because way that I do budgets, I like to know what my overall cost is and then where it's all coming from. But yes, I do have a meeting tomorrow with Audubon and am reaching out to other funders to hopefully help supplement the need that's there.
Thank you.
So Trina, I think that Michaela's got the total targets and the cost to make those targets, and then how much you have to raise to hit those targets.
Okay.
I mean, it's all there on that presentation in terms of how she's going to spend it. Like she has to buy some more trees and project manager and that kind of stuff.
All right.
So
thanks.
I think the information's there.
We do have a question here from Lena.
On the one slide, you had, I think it was $30,000 for administration and another sum for project lead. And I'm wondering what the difference is there and what the administrative costs are that you're talking about.
So I've got a bookkeeper that's keeping track of our funds. That's part of the administrative fees. We've got everything like the insurances, workers' comp, all those things that have to be paid out towards keeping our employees safe, things like that, as well as making sure that we have the general liability insurance to cover any mishaps. there has been a significant amount of people that have been helping this project as well as kind of getting it going. I just want to make sure the administrative fees that are within the DFC, you could see it's not the $30,000. It came out to about $9,000 some odd dollars from the request there. So that's just the total amount of administrative fees for the entire 2024 year. That's not what the actual administrative fees are looking like for being funded from the DFC.
And the
Okay,
project
that's-
lead,
But your estimate is 20%.
What was that?
But your estimate for administrative costs is 20% of the whole of your budget, right?
It's less
Didn't I see
than 20%. Yeah, it's less than 20% there, and that's including all of our administrative fees, everything that we have to pay in order to keep going. $30,000 is not 20% of $356,000, 350. So that's that. And then the project lead, half of his wages are paid through the Alliance for Workforce Development. The other half is to be paid out because he doesn't qualify for the full wages paid through the Alliance for Workforce Development. So that's the wages you're looking at there. He's the one that keeps our crew going. He's creates the things like the work map, the spreadsheet, things like that. So
Hold on, Michaela, on the
Again,
admin,
that's again for
30K.
the entire 2024 year.
on the the 30K admin, how much of that is your wages?
I have not even tried to think about making wages for myself off of this project. So everything that has been received so far, I haven't made any kind of money off of. So that would be something that I would discuss with my bookkeeper. However, we're talking about a possible wages of $30 an hour for just the hours that are going in towards planting
Michaela, you cut out a little bit there. Could you just repeat it,
of the
please?
trees, which is 4 days. So at about $30 an hour for just the 4 days of 10-hour days while we're out here planting the trees. That's not going into the work that I do on, Fridays, Saturdays, Sundays. I'm working on this project almost every day. So there is a certain amount that, while I'm working on this project that I would hope to make, but that's not going to be that whole entire $30,000 there, of course. That's a number that would also include bookkeeper services and any other administrative people that we have under our belt.
All right, team, from the steering committee, any additional questions for Michaela? All right, Michaela, you're more than welcome to stay signed on. However, I think some additional deliberation from the steering committee just to talk amongst themselves as they work towards a motion to approve or not. Move on.
Okay, thank you.
Hey, Michaela, I do have one question. Would it be okay for me to share your budget and your outline with Audubon or other funders in support of this project? I haven't done
Yes.
it yet because I needed your permission.
Yes, and if you have anything else that you may need from me, I would be happy to send that to you as well.
Thank you.
For the steering committee, again, if you all want to kind of kind of talk amongst yourselves with regard to what you're thinking here, then what will then culminate to is a motion a motion to approve the funding request. If anybody is ready for that, and then obviously a second, and then we'll do a roll call vote. Again, this afternoon, we do plan at, Matt's prompting on Friday to have a strategic granting conversation around how the Dixie Fire Collaborative Steering Committee has been and is using the funds available towards granting and funding various projects that we know are either on the horizon or that are currently there. And so that's definitely a consideration as we continue to move through the next 6 to 12 months as to what it is that along different lines of effort people feel and the steering committee feels need to be funded in a way.
Can I just,
Yes.
I think that the question that Matt brought up, or the concern that Matt raised about having that conversation, is one that really ought to happen before we make a decision about the Dixie Fire Canopy project, which I agree with is a really great project. But also, given what we just heard from North Valley Catholic Services, I think we have some priorities that need to be set as a steering committee before we should vote on anything. Anyway, that's my 2 cents.
I completely agree. I think we should have the conversation before we make the vote.
Why don't we have the conversation today and then make the vote on the Dixie Canopy project today as well? Because here's the thing, actually planning out what we're going to do and how we're going to split up the money, that budgeting conversation is we can do a lot today, and maybe we can get to somewhere, but there might be more discussions and work that we need to do to like finalize our kind of budget for the next couple of years. But definitely, how about we come back in terms of our agenda? We can come back to the Canopy project and see if it fits in at the 100K level at the end of the meeting. Would that be good?
Sounds
I
good.
would- I feel like this is a planning process, and I'm sorry, Marcia, got your hand raised and I jumped in. But I feel like this is a planning phase, and I'd like to actually plan like a strategy, like what is a strategic plan for spending, and be a little more precise about it, because what I want ultimately is equity. Like for every person who applies, I want there to be some consistency in a process, and for us as a steering committee to understand that consistency and what that means to the community. And then what has the work been done to date as far as prioritization, what has been funded. I would like a little bit more than that, Matt. I would like a specific.
I agree. I agree. I mean, it's a bit.
Yeah.
It's a big conversation, and the sooner we start it, the better. But I just don't want that to be a reason to not to fund other things as we're kind of like going through these deliberations.
Yeah.
Can
if we can do that
Can I
Friday
introduce
and get
somebody
it
real
done.
quick? Can I cut you off? Hi. So we just planted her property today, and here she is. She just walked up on us.
So I am so pleased. It is so exciting. And I hope this project continues because it's so rewarding to everybody that is living here. And we need this. Hi, Greg.
Hi, Terry. Nice to see you. Welcome back to town.
It's like, woohoo. So I'm very excited. So
Thank you.
all right. Thank you, guys.
Hey, it might actually be easier for us to talk or make this decision if Mickey's off the line, and then we might be able to deliberate. So, Mickey, can we call you back later on? Is that a good idea, everyone?
I think
Yeah,
that's a great idea.
Okay, Mickey, can you drop?
Yes, sir.
Thank you.
So do we know how much that the NVCSS is asking for?
I can pull they applied on Friday. So Northern Valley Catholic Social Services, but the general number is around $312,000 per year.
300,000?
$312,000 for the year.
Is PRS also going to be asking us for money?
Yeah. So PRS included in today's agenda is their ask of about of approximately $136,000 for the next 6 months from August of 24 to February of 25. So that's the next agenda item.
And remind us how much we have altogether.
We have approximately $1.4 million that's left uncommitted at this point.
So that would take a third
It's
of it.
it's $1,450,000 that's roughly uncommitted at this point.
That would bring us down to like $880,000 if we did all of three of them.
Did all three of them. We're looking at for disaster. If the steering committee saw fit to fund the both disaster case management programs, for one for 6-month period, one for 12-month period, that would come to the tune of about $500,000. And then with regard to the Dixie Fire Canopy project, at $100,000, then you're looking at $600,000. So yep, just right there, it would be about $8,500 or $850,000 left uncommitted. Yes, Paula, you have your hand up. Oh, I'm sorry. Marcia's got a follow on to that, and then
Yeah, so I'm just wondering, so after 12 months for the Catholic Charities and after 6 months for PRS, do you think that they'll be done, or do they foresee coming to talk to us again about needing money for something else? I'm just wondering about budgeting our money.
Almost certainly come back.
That's a good question. And Paula, with regard to this, the 6-month ask, you'd be more inclined to be able to answer that one.
Right. So Marcia, both myself and Sarah, who is our grant writer, met with Patrick and Kim DeFore from North Valley and agreed that we would ask for 6 months at a time so that we would know where we were after 6 months rather than just deciding we needed a year, because we all know there's a big chunk of winter in the middle of there. So that's why we submitted for 6 months rather than a year, with the anticipation of looking after the beginning of the year, where are we now and what does it look like? Does that answer your question for PRS?
Yeah.
Okay.
So again, as it relates to the Dixie Fire Canopy project, well, actually, for any of these grant requests, again, lots of money being asked for. The strategic granting or strategic planning, if you will, conversation been in the works for a while. You know, February we had a relatively wholesale change of steering committee members by adding or replacing 4, and you know, at least wanting to get our newer members at least somewhat acquainted with just the steering committee and the Dixie Fire Collaborative overall. So here we are 3 months after that point, being able to have the conversation again, as Matt has suggested, not a bad thing to do today, to be able to start leaning into what the next, 12 to 18 months could look like, even the next 6 months, to start that, and then really getting things confirmed, no later than July for long-term planning. We do have these programs here. The FEMA funding with regard to the disaster case management program, the FEMA funding in its entirety runs out in August. So that's definitely going away. As it relates to the Dixie Fire Canopy project, the ask that Michaela has is to be able to move her program, it sounds like, from these initial phases into much longer term phases that she has planned overall through the summer. So it would be sort of prioritizing what the needs are right now and whether or not this is the right time, or if it's something that people would like to wait on. I think some type of decision in that Michaela's been working on this since February. She had her initial grant request, I think, done in February. At that point, it lacked detail, and then she brought it back around the last time it was the February, or I'm sorry, so it took about 2 months to kind of get some more detail on that. So that went from February into April. And then when we met on April 15th, Monday, April 15th is when Michaela presented her grant request in its entirety. We met again 2 weeks ago. There were some additional questions with regard to the extent and scope of what she was asking for, and that's what kind of brought us to this point. So I share that just it's, you know, these are big questions to answer, but you know, for a would-be grantee, she's been at it for a few months, and then you all have been at it for about a month now. And so if you still have lingering questions and or doubt, we just need to kind of try to clear that up today is my recommendation, so that we can just kind of move on. And if there is more, yep, go ahead, Marcia.
So I'm wondering if we should give her $50,000 so that she gets through the fall or whatever, and then see what Audubon gives her and some of these other things. And then she could come back in the fall if we have any money left and give her some more money.
Can we
love
give?
For me,
Yeah.
I mean, giving people like 50 cents on the dollar just cause, it doesn't make much sense to me, because like, I don't think that it's necessary. Like, we've got this big chunk of money that we should spend as soon as we can. You know, it's 3 years since the fire, and I really think that we should be serious about spending all this money in the next year or so, you know, or 6 months, like relatively quickly. And I don't see it as being like something, oh, how much we got left, we have to retain something else, you know, like if we have opportunities to give, and it's been thought through, and it's going to directly, I mean, this is something that's real, you know, like these trees are really going in the ground, you know, they really are happy people, like these trees will go on living for whatever, next 100 years or something like that. It's a very tangible project, and it's going to really impact the what's going on. And I think that if we do put in 100K, then I think that hopefully we can get the NVCF to put in the rest. I just don't like, because otherwise what we're saying is to Michaela, hey Michaela, waste more time talking to more donors. It's such a big time sink, you know, and we're saying for no particular reason, you know, like you asked for 100, we're giving you 50 just cause whatever, half or something like that. I don't think it helps anyone if we do that.
Well, I'm for giving her the $100,000. I was just trying to compromise, I guess, with other people.
Yeah, and that's something we discussed and hadn't gotten a clear answer on either, is are we planning to just spend the money down and be done? Or are we planning to leverage that funding and try to do more for the community? And I was more on the part that I thought we were trying to leverage funding. I've worked in the grant world most of my life, and I know how important that is. But if we really just want to spend it and be done, that's something that we as an organization, or at least the newer board member or steering committee members I haven't had clarity on. And you know, for me, I know I'm on the IRWM steering strategic leadership team. I've been advocating at the state policy and legislative level for disadvantaged communities, for more funding to come into our communities. And so I've worked for years in trying to bring more resources into our community. And so that's when I ask, you know, and yeah, absolutely, international or outside organizations, if we can bring more funding into a disadvantaged community, I think our community is going to be stronger. And so I do agree with Marcia, and it's not the 50 cents on a dollar for me. It's about a disadvantaged community with the inequities of taxation based on population that we all live with, you know, when it comes to public services, safety, education, and healthcare, as well as other things. And so for me, I've thought that leveraging this funding to find ways to bring more into the community, either in services or money, is our best bet. And I do think that the Dixie Fire Canopy project is a highly fundable project. And I think that there could be funding from outside resources. And I don't want Michaela to get the idea that her local community isn't supporting her, as she has already expressed. We are supporting her. And I myself have reached out to other funders that I know that I worked with in the past that I thought would be a really good match for that project. And so giving a portion, it's not 50 cents on the dollar. Yes, she is doing more work. I'm personally willing to help her do some of that work to lift some of the burden. But those are some of the points that I need clarification on moving forward. And I think this team, it's an incredible group of volunteers that really cares about our community. But what direction are we going?
We'll go Lida, Greg, and then Dax.
Go to Dak, go elsewhere.
Okay.
Yeah.
No problem. Greg, did you have your hand up or did you take it down?
I did. And again, I agree with Trina. I don't see this as like, oh, we've only got so much. Well, we do only have so much. And I want to maximize the impact of that. I want to leverage it. Not just, I mean, we could spend it all today. I mean, what I want is the maximum reward and return on the investment that I can get for rebuilding Greenville. And so that's, I mean, I'm definitely would go with, okay, let's fund half of it. Let's see if she comes up with another matching grant. Because, I mean, clearly she's generating, lots of people want this. And I get it, lots of people want it. But, and I think it'll help the community. I mean, I think it's a beautiful project. I just would like to see if she can get funding from another source so that we have more money to put into another project that benefits the community. I think that'd be great. I want to see, like, how much can we benefit the community and spread it around?
Okay, thank you, Greg. Dax?
Okay.
Yeah, I just kind of wanted to speak to the conversation about leveraging. I'm all for leveraging the money as well. That's something that I brought up very early on. However, I haven't seen very many proposals on how we do that. And, I'd love to see those, but they just haven't come along. And it has been 3 years now, like Matt was saying. And, how long are we going to wait for the perfect, proposal or whatever to just show up on our laps? I'm kind of getting to the point as well where if we're not having any, big grand ideas coming up, then maybe it is time to just start wrapping this up here. I don't know. That's kind of where I'm at the moment.
Go ahead, Greg.
Maybe going forward in the future, we look at, like, we want to have grants with we'll do matching grants. So that, if you have a project, unless, that's something that we want to see in your request, is that you're, like, generating sources or income from other sources.
I mean,
So like Michaela's?
Michaela's raised 60 grand from other places.
Yeah.
That's exactly what Michaela has shown, as far as I can see.
I mean, this thing of should we spend the money, or is it going to be like leverage the money? There's no way that we should be applying for grants. Sure. I mean, and that doesn't cost us that much. But at the moment, we've got $1.4 million, right, that we should spend. We don't need that. Like, even to be applying for grants, we don't need $1.4 million in the bank. We've just been spending it quite slowly. And I mean, I don't think we have a clear priority at the moment about what we're spending on. That was why I was like, hey, we really have to talk about this, because I mean, that's what we've got, that we've got money to spend. That's the priority, all these other things are like other things, but we've got money to spend, and we should plan how we're going to spend that money, because otherwise that money's just going to sit there, and that's not good for anyone, just sitting there. Has no benefit just sitting there. It'll be benefit when it's, like, actually spent in the money in the community. So as soon as we can do that, and then and sure, we can write some grants. We should do that too. that's not, I don't think it's a one or the other. I think we can plan to spend down as much as we can. And if we get raised another couple of $100K, great, we could spend that too. But spending this down as aggressively as we can in the next 6 to 12 months, I think is what we should prioritize. And in that time, sure, if we have raised some more grants, maybe that's additional stuff. But I don't think that having this DFC thing going on for 5 years, 10 years is like, it's got anything to do with the fire then, you know? And then also my thoughts about the disaster case management stuff is a lot of that is 3 years after the fire. There's a lot of people in our community who don't have access to technology, who live in poverty, whose life is really hard, and and their lives were impacted by the fire, but that was a long time ago. And I think we have to recognize that the ongoing help for people is really important, and maybe that's what we should be doing. But a lot of the stuff is going to be less and less fire related in terms of the issues that these people are facing. It's kind of like living in poverty in America. Is probably a lot of the issues that are still going on, and that doesn't mean that we shouldn't help them or we shouldn't fund these DCM things, but like that's kind of how it's evolving, you know. Like the fire was a long time and people still have problems and stuff like that, but we should recognize some of these things we're going to be spending money on for the good of the community and may not be directly related to the fire. Because you take the Marsha's question about, is this going to be over in 6 months' time? I mean, we had the same question like 6 months ago, you know, and I think that the needs of our community will continue forever, you know, or for the decades, you know, in terms of the people have these needs. And some of them are related to the fire, some of them not, right? But I think that those needs that they're fulfilling in terms of help with paperwork, buying this, buying that, are going to be needs. It may not be the most efficient way of supplying those needs versus actually just giving money directly to these people so that they can buy the firewood and kerosene and food and whatever, rather than having it go through some administration people and they buy the kerosene and all these things. It's a very, very expensive way of providing goods and services to the people that we're benefiting in terms of that kind of giving money to these people, giving money to these people. So I think those kind of points about, is this the most effective way of giving money to these people? And are these people getting the money? Is it got anything to do with the fire at this stage? And are these things going to be ongoing forever, you know, or for a long period?
Yep, with regard to the disaster case management program, we are going to talk a little bit more about that here in a moment.
Cool.
We had Greg with his hand up and then Paula with her hand up. So Greg, real quick, you had a comment?
Basically, I was agreeing with Matt. I mean, the only thing that I really saw in the North Valley's presentation that was kind of related to rebuilding, as opposed to take like social service and taking care of those in need, was there's like 10 people who are applying for the Recover California grants to rebuild houses. 10 people, and 3 of them have already gone through the process, and there's 7 that are still in the process. I mean, and then other than that, it's kind of just taking care of people in need who were in need probably before the fire, and good likelihood will be in need after the fire. And I think that those people need to be taken care of, but I think that, in my opinion, that's a kind of a different funding source. You know, not to throw them under the bus, but I think it's just, yeah, it's just a different source of funding.
Okay, thank you for your comment, Greg. Paula?
I was going to respond to Matt. I can only speak to the presentation that PRS is supposed to provide, which is really what our request is for what we would be doing after August, which is helping the 30 people we have on our caseload that are truly rebuilding, whether it's through Recover California or their own rebuilds. It is in my presentation. This isn't about kerosene and wood and all of that. This is about truly rebuilding. It's not the resource center. So it's something different. It is in the presentation that I know that Patrick sent out on behalf of PRS. So it is different. It's not social service needs. This is truly rebuilding needs.
Okay, thank you, Paula. Yes, Trina.
All right, thank you for that clarification, Paula. I kind of was wondering the same, and I think that most of us had agreed that we've kind of transitioned from immediate needs into longer term. So that clarification helps me there. But I'm going to press back a little bit, Matt. I think a lot of what you said was true, but I've been involved in helping write some pretty large grants where it might be $15 million, it might be $25 million. And going back to the infrastructure plan, infrastructure costs a lot of money. And if we need matching funds, we might need $1 million of matching funds or more for a $15 million grant. We might need more than that. And so my thought is that pot of money isn't just sitting there waiting to be spent. It's sitting there leveraging, being able to apply for 15 million and more grants to support that infrastructure development need and the parks and the other things that we've looked at. So that's my thought process and the human aspect. I do feel like there are other services possibly available. I'm not versed in that, so I won't speak to that. Paula and the CSS folks and other folks who've worked specifically in there know that that's their wheelhouse. But I will, I can't stress how important it is to have matching funds for large grant applications. And if we're not going to go there, then that's fine. But to me, that's part of this decision is, are we just going to spin it down and be done? Or do we want to look at leveraging more money for infrastructure needs or for some of the unmet needs to date and 5 years into the future, because it's going to take that long to build things.
So Trina, are there specific grants in the works that you're talking about that we could potentially use our funds to leverage towards?
There's none in the works because no organization has taken that up yet that I know of, but the Dixie Fire Collaborative as an organization and being a 501c3 under the North Valley Community Foundation could apply for those things. And I know how to do that. I can help guide that process, but it is, those are very large grants and they're pretty time consuming. And I know a year ago, people were talking about potentially hiring a grants writer to help do that. And is that a direction we would want to go or not? I can't expect Patrick to do all that plus what he's doing, or any of us to completely volunteer our time, because it is a specialized skill that is time consuming.
Yeah, thank you. Oh, go ahead, Dax.
No, I don't have anything else.
Okay. So team, this has been definitely a fruitful conversation. We still have the issue of funding the Dixie Fire Canopy project. Also on our agenda today is just the general background from Plymouth Rural Services. So I do want to give some time to that. And what we can do is we can table the Dixie Fire Canopy project at this funding request for right now, not completely for the meeting, but just for right now, so we can also have this discussion around PRS. And here's some of the information that they have provided for us as well. And then we'll kind of circle back here today. So with that, I would like to turn things over to Paula, specifically for that. And I can share if need be, or if you wanted to share, Paula, whatever works.
Either is fine, Patrick, whatever works for you.
Okay, I'll go ahead and share your presentation.
Great, thank you. Thanks, Patrick. So Plymouth Rural Services, as you are probably aware, is the local nonprofit. We've been in Plymouth County for 44 years. We've taken care of our community and our people that long. I provided a bit of a different approach to disaster case management and our intention. Our intention is for the period after August. So what we intend to do with the amount of money that we're requesting. I did provide an overview of what disaster case management is, since there are some folks on the steering committee who are new and hadn't been involved since the beginning. One of the primary functions of a long-term recovery group, which is what the Dixie Fire Collaborative is to address the disaster-related unmet needs of fire survivors. If you could move forward, Patrick. I think one of the key things that you need to understand about disaster case management is that there's funds that are set aside in the unmet needs that only disaster case managers have the ability to access on behalf of their clients. So either our disaster case managers or NBCSS disaster case managers will go to the funders roundtable with a case of unmet needs. It could be a variety of things, from household goods like beds, basic furniture, to solar panels, to electrical type issues. We've had a variety of different things, and those are taken to the roundtable to make a decision. Those funds are then provided by the roundtable to the disaster case manager, who gets bids and vendors to be able to take care of those expenses. So that is the only way for the client to be able to get their unmet needs met, is through a disaster case manager. So as Cindy mentioned, disaster case management's goal is safe and stable housing. So that means a house that is clean, safe, has water, has electricity, has simple furnishings. We're not looking to put the best of everything in someone's house. We're looking to make sure they have a place to sleep, a place to sit, a place to eat. So Patrick, if you could move forward. Thank you. These statistics to date are for the PRS DCM. To date, we've served 1,405 people. We've closed 1,151, and with goals accomplished 109. That is a bit of a deceiving number, the goals that closed to date and the goals accomplished. Many folks come to us with just needing referrals, so we'll refer to local programs. We'll refer to many of the programs within PRS itself. We offer 19 different services, and so that's why it's a bit deceiving. 109 goals accomplished means the client had a goal related to their safe and stable housing, and we have met that goal. We've made 2,933 referrals, totaling $15,529,247.69. Much of that is from the Cal OES donated travel trailers that PRS accepted as a donation, managed the donation process for that. So that is a lot of what that money is. If you could go forward, Patrick. I wanted to provide the steering committee with a picture of the funds that sit with Plumas Rural Services. So just a little background, you'll see on this chart, the two bottom ones, PRS Unmet Needs and American Red Cross Stabilization Funds. Those are both funds that PRS applied for very early after the fire and were able to meet the needs of fire survivors in a wide variety of ways, from helping pay for food or clothing or a payment of a water bill. As many of you know, water bills were exorbitant after the fire, so we help folks with those sorts of things. We later on started working with the Simple Unmet Needs process, which is that top number. That is the number of dollars that were donated by North Valley Community Foundation, the Dixie Fire Collaborative, to meet the unmet needs of fire survivors. So between the top number and all the way down to gas cards, those numbers were all for a variety of different things: gas cards, weatherization, client stabilization, and then permits and that sort of thing. So PRS manages those funds. And basically, after the DCM is successful with an unmet needs request, it comes to PRS to issue the checks. So that's why we have those funds. You'll see on the right-hand side the funds that are remaining in each of those counts. We have about $95,000 remaining to issue to fires on behalf of fire survivors, not to fire survivors. That's an important thing to remember. And that can be for anything that the Unmet Needs Roundtable deems as an appropriate request. Can you go ahead forward for me, Patrick? I wanted to give you a little bit of a tier level, overview. A level 1 means the client has a quick unmet need. It's usually a referral. A 2, 3, and 4, the level of need is escalating all the way down to a 4 means the home has been destroyed. By the end of August, we will have 3 and 4 tier levels left, which those are our folks with the biggest amount of need. If you could go forward, Patrick. This is sort of the overview, and this is all in the handout that Patrick gave you, so I'm not going to go over it specifically, but this is kind of what a client has to go through to be able to access funding. It is a process. It takes a lot of paperwork. It takes a lot of work with the DCM to come up with goals and get bids and go through the process so that we can go to a funder and ask for the funding to pay for whatever it is that the client needs. We don't go to the unmet needs roundtable until we have accessed everything that we possibly can, whether it's through the SHOP program, through United Way, through client stabilization, through donations, or any of the other number of things that we use to access funds. So if you could go forward, Patrick. This probably is the most important slide that you'll want to see, and this is what PRS anticipates we will be at the end of August 2024. We anticipate that we will have 34 clients in the tier 3 and 4 category. You'll see that the majority are in the 3 and 4 options. I think we have one person that's in a tier 2. Unfortunately, they were mistiered at the beginning. They should have actually been a 3. When I spoke with Patrick and Kim at the beginning of submitting this request, they asked me to do a comparison of what we would have remaining as opposed to what the outstanding need of the client would be. So that would be what their unmet need was. Our projection right now is $162,500 based upon our clients. This is not the clients through MBCSS, so that's an important thing to know. That's about $62,000 more than we currently have in the unmet needs fund. So that is a potential place where the DFC would want to fulfill the unmet needs funding, depending on what the DFC wants. Of those folks that we have listed, we have 21 survivors in the portal for Recover California. We've helped them get through the paperwork process. When they get their home built, they will need to be able to furnish their homes. We have 7 homeowners who are doing rebuilds or manufacturing homes, 2 who are still seeking rentals, and 4 are needing financial assistance with furniture or other needs. Go ahead, Patrick. This, I wanted to share this so that you all understand what happens as a disaster case management program closes down. This is what we receive from Catholic Charities, who is our funder. It's funneled from FEMA to the state and then to Catholic Charities. So essentially, this is how FEMA puts it to us. The disaster recovery starts with the community and ends with the community. So at the end of disaster case management, if we're not funded, the cases turn over to the long-term recovery group to finish up how the cases are going to move forward. So I wanted you all to be able to see how this works for us as we're closing things out. We're in the process now of identifying survivors who will not be fully recovered. We're no longer allowed to accept cases after the beginning of July. And then we will start turning over to the state the names of folks who won't be fully recovered. Go ahead, Patrick. And that's it for me. Questions? And I think you probably got the grant application that Sarah wrote as well, along with our budget.
I'll share that real quick. Here's the grant, the overall grant application. That was included in the board packet, or the committee packet rather. And then the overall budget is provided as the last page down at the bottom here. So I think you all are looking at that right now. Is that correct? You guys see a spreadsheet in front of you?
Yes, I can see it,
Yeah.
Patrick.
Okay, thanks.
I think I'm not trying to be offensive to my partners from NBCSS. If we do end up having to just fund one program, PRS would be able to take on the additional clients if NBCSS doesn't move forward.
I'm sorry, what, would you repeat that, Paula?
Yes, they, as of right now, they have 9 level 3 clients, seven level 4 and 28 untiered clients.
Mhm.
I just wanted to be clear that if NBCSS isn't funded moving forward, PRS would be able to accept them onto their caseload as the
Okay.
local DCM.
So just again, timeline stuff. In February, both programs were extended by FEMA, so they received an extension to August of 24. So here it is May. So we're about halfway through that 6-month cycle of extension from February to August. And, you know, that's why it's a present conversation so that we can start to necessarily plan in the variety of ways that this may play out, given the cases that are left, and be detailed and specific, like anything, like with any of these asks. It's going back to the data and trying to understand best what the need is, what the requirements are, so that it can be adequately resourced and supported. And with regard to if both of these programs sunset and they go away in August, and then it's Cal OES's intention or FEMA's intention that it goes to the long-term recovery group, i.e. the Dixie Fire Collaborative, and me on a daily basis. You know, Cindy was kind enough to share with me a Cal OES point of contact because I just want to start, I want to start just creating a demand signal with them of where we are and what the need might be as we get closer and closer to August, to help, you know, provide that clarity so that decisions can actually be made. And likewise, I'm trying to do the same thing with FEMA. So between our emergency management service organizations at the federal and state level, of just making sure that those plans are articulated early and often. So if there would ever be an additional funding stream coming from state or federal agencies, that we know what that looks like now, because these next 3 months are going to evaporate very quickly. Yes, Matt. Matt, you have your hand up?
He's gone now, Patrick.
Yeah, it looks like he fell out. Okay, I'm sure. Oh, go ahead, Dax.
Yeah, Paula, how long do you foresee the remaining clients needing DCM services? Like, how much longer do you think it needs to go on to wrap up the majority of the remaining cases?
Right, so those, I think, DACs that are not in the Recover California program, they would be closed by the end of February. Those that are in Recover California, I don't believe building even starts until 2025. So those folks would still be in the pipeline. They would need to be able to access unmet needs funding in some form or fashion. So it really depends on whether or not the long-term recovery group wants to handle those clients themselves that are in the Recover California portal, or whether they want DCM to be able to do that.
Okay, thanks.
Yeah.
Cindy, you have your hand up?
Yeah, just to kind of give you guys an idea with the Recover California grant, because that's something that we went through Campfire, and that was actually my first disaster that I managed. They're still ongoing right now. So they're still rebuilding as we speak. There have been homes that have been completed, but we're looking at what, 6 years, about to hit 6 years now. And they're still continuing this project, and they're still looking at the rebuild phase to take on at least another four years before they can fully recover. So they do them in phases. The importance of, as Paula mentioned, disaster case management in this instance is that the disaster case manager assigned to them through Recover California is necessary. They are in Sacramento, therefore they do not have that direct access to be with the survivor one-on-one, and that's where the disaster case manager from both PRS and NVCSS has been very imperative, because we've been that middle conduit as far as getting all the necessary data and information, and also doing those site visits for the Recover California application process. And then once it transitions into the rebuild phase, they're also kind of that support system for the survivor themselves as well. So it's a very intricate process, and it's a very lengthy process. Even though they have their own structure, a disaster case manager is imperative to truly have to be that support system in between, to also, like Paula mentioned, to fund the interior of the home afterwards as well, which is where the unmet needs and the SHOP program through United Way is also coming, or has been very supportive of that. So just to kind of give you guys an idea as far as lengthwise.
Okay, thank you for that information, Cindy. Matt, I think you had your hand up. Are you back? Matt Fogarty, are you back? Looks like you're on. It's still muted.
I think he's frozen.
Okay. Team, again, both of these, so we're kind of like at, these different stages with both entities, and there'll be more deliberate conversation at the next meeting around disaster case management and potential funding opportunities. So this is the information that you have now with regard to Plumas Rural Services. Again, we'll get the brief from Northern Valley Catholic Social Services, plus I'll send out their grant application that they submitted in the portal, the NVCF portal. So you have those, and then we can do a kind of, you can be able to look at both of those and figure out what the general needs are for both programs. And then, of course, you can always go point to point with either Cindy or Paula with your questions. And I think you definitely have Paula's